Can you reverse Alzheimer's? There is no cure for Alzheimer's disease. Once a person starts showing signs, memory loss and problems with learning, judgment, communication, and daily life, there aren't any treatments that can stop or reverse them. But there are medicines that can ease some of the symptoms in some people. How long can you live with Alzheimer's? However, not all people with MCI develop Alzheimer's. The symptoms of Alzheimer's disease worsen over time, although the rate at which the disease progresses varies. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis, but can live as long as 20 years, depending on other factors. What is the best treatment for Alzheimer? Medications called cholinesterase inhibitors are prescribed for mild to moderate Alzheimer's disease. These drugs may help reduce some symptoms and help control some behavioral symptoms. The medications are razidine, galantamine, Exelon, rivastigmine, and Aricept donepezil. Will dementia ever be cured? There is currently no cure for dementia. In fact, because dementia is caused by different diseases, it is unlikely that there will be a single cure for dementia. Research is aimed at finding cures for dementia-causing diseases, such as Alzheimer's disease and vascular dementia. Read more about the causes of dementia. What triggers Alzheimer's? Scientists believe that for most people, Alzheimer's disease is caused by a combination of genetic, lifestyle and environmental factors that affect the brain over time. Less than 1% of the time, Alzheimer's is caused by specific genetic changes that virtually guarantee a person will develop the disease. How do Alzheimer patients die? Although Alzheimer's disease shortens people's lifespans, it is usually not the direct cause of a person's death, according to the Alzheimer's Society, a charity in the United Kingdom for people with dementia. Rather, people die from complications from the illness, such as infections or blood clots. How old is the youngest person with Alzheimer? The youngest adult given an Alzheimer's diagnosis was 27. Sanfilippo and NPC are close to Alzheimer's, but as far as early onset Alzheimer's is considered in adults, Jade Green was diagnosed with the disease at just 27 years old, Express.co.uk reports. Why do Alzheimer's patients stop bathing? People with dementia may become resistant to bathing. Such behavior often occurs because the person doesn't remember what bathing is for or doesn't have the patience to endure lack of modesty, being cold or other discomforts. Loss of independence and privacy can be very difficult for the person with dementia. What is the number one food that fights dementia? Cruciferous vegetables. Broccoli, Brussels sprouts, cabbage, and other cruciferous vegetables contain sulforaphane, which powerfully assists in DNA repair. They're also high in folate and carotenoids, which lower homocysteine. High levels of this amino acid are linked to cognitive decline and dementia. Is there a test for Alzheimer? Medical tests. There is no single diagnostic test that can determine if a person has Alzheimer's disease. Physicians, often with the help of specialists such as neurologists, neuropsychologists, geriatricians and geriatric psychiatrists, use a variety of approaches and tools to help make a diagnosis. Is there any hope for Alzheimer's? There is no cure for Alzheimer's disease, but Johns Hopkins researchers are learning that there are things people can do that may help slow cognitive decline. Can you die from Alzheimer's? Although Alzheimer's disease shortens people's lifespans, it is usually not the direct cause of a person's death, according to the Alzheimer's Society, a charity in the United Kingdom for people with dementia. Rather, people die from complications from the illness, such as infections or blood clots. What is the best treatment for Alzheimer's? Medications called cholinesterase inhibitors are prescribed for mild to moderate Alzheimer's disease. These drugs may help reduce some symptoms and help control some behavioral symptoms. The medications are razidine, galantamine, Exelon, rivastigmine, and Aricept donepezil. What is the difference between dementia and Alzheimer's? Dementia is the term applied to a group of symptoms that negatively impact memory, but Alzheimer's is a progressive disease of the brain that slowly causes impairment in memory and cognitive function. The exact cause is unknown and no cure is available. What country has the lowest rate of Alzheimer's? Those with the lowest rates include India, Cambodia, Georgia, and Singapore. To put the cost of this disease into perspective, if Alzheimer's represented a country's economy, it would be the 18th largest in terms of economic impact. This would place Alzheimer's between Turkey and Indonesia. What age does Alzheimer's start? When Alzheimer disease occurs in someone under age 65, it is known as early onset or younger onset Alzheimer disease. A very small number of people with Alzheimer disease have the early onset form. Many of them are in their 40s and 50s when the disease takes hold. How do doctors diagnose Alzheimer's? To diagnose Alzheimer's dementia, doctors conduct tests to assess memory impairment and other thinking skills, judge functional abilities, and identify behavior changes. They also perform a series of tests to rule out other possible causes of impairment. Can Alzheimer's be brought on by stress? The link between Alzheimer's and stress needs to be further examined, but researchers believes that stress can cause inflammation in the brain, making the brain more susceptible to health problems like dementia. Stress can also lead to depression, a known risk factor for Alzheimer's and related forms of the disease. Why do Alzheimer's patients stop eating? They may forget mealtimes, lose their sense of hunger and thirst, or become unable to determine the proper amount to eat. They may also struggle to incorporate enough variety into their diets, which means they're not getting the vitamins and minerals they need. Can anxiety cause Alzheimer's? Anxiety disorders could lead to Alzheimer's. A new study has found that increasing symptoms of anxiety and depression may be linked to an increase in beta-amyloid proteins, a hallmark characteristic of Alzheimer's disease. Do Alzheimer patients sleep a lot? If you know someone with Alzheimer's, you may notice that they often spend a lot of time sleeping, especially in the disease's later stages. Rather, the changes in the brain caused by the degenerative disease can interfere with a patient's circadian rhythm, the daily cycle that helps determine someone's sleep patterns. How do Alzheimer patients feel? They go on to provide similar examples for every feeling about which they write: loss, isolation and loneliness, sadness, confusion, worry and anxiety, frustration, fear, paranoia, and anger. How long is the last stage of Alzheimer's? On average, people with Alzheimer's disease live between 3 and 11 years after diagnosis, but some survive 20 years or more. The degree of impairment at diagnosis can affect life expectancy. Why do Alzheimer's patients cry? Sadness and crying. As Alzheimer's progresses, your loved one may start to behave differently. They may feel sad and cry more often. Crying about little things is common in certain types of dementia because those little things affect areas of the brain that control emotions. How quickly does Alzheimer's kill you? The average life expectancy for a person with Alzheimer's is 3 to 11 years after diagnosis, but people can live with Alzheimer's for 20 years or more. If a person's symptoms appear before the age of about 75 years, they are likely to live for another 7 to 10 years after diagnosis. Does Alzheimer's run in families? Family history. Those who have a parent, brother or sister with Alzheimer's are more likely to develop the disease. The risk increases if more than one family member has the illness. When diseases tend to run in families, either heredity, genetics, environmental factors, or both, may play a role. Why do Alzheimer's patients stop talking? At this stage, the brain has been significantly damaged. As a result, they become dependent for all activities including mobility. It is also at this point that their speech becomes difficult to understand. In fact, they may stop speaking completely.